Pnawn da. Eluned Morgan dwi, Gweinidog Iechyd a Gwasanaethau Cymdeithasol. A gyda fi heddiw mae Dr Chris Jones, Dirprwy Prif Swyddog Meddygol Cymru. Dydd Gwener esboniodd y Prif Gweinidog ein bod unwaith eto yn gwynebu sefyllfa ddifrifol yma yng Nghymru oherwydd lledaeniad yr amrywiolyn Delta. Fe wna i ofyn i Dr Jones i sôn am yr amrywiolyn hwn a'r hyn i ni'n gwybod amdano nes ymlaen. I am Eluned Morgan, Minister for Health and Social Services, and today I'm joined by Dr Chris Jones, Wales's Deputy Chief Medical Officer. Now, on Friday, the First Minister set out that we're once again facing a serious situation in Wales because of the spread of the Delta variant. I'm going to ask Dr Jones to set out what we know about the Delta variant, and I will focus on the work we're doing to keep you safe over the next 4 weeks. Gallwn ni gyd gymryd camau i ddiogelu'n hunan a'r pobl i ni'n caru. Fe fydd y ffordd i ni'n ymddwyn yn gwneud gwahaniaeth yn ystod yr wythnosau a'r misoedd nesaf i ledaeniad y feirws. There are steps we can all take to protect ourselves and our loved ones. Now, the way we behave will make a difference in the weeks and months ahead. Dr Jones, I wonder if you could start by setting out what we know so far about the Delta variant.
Thank you, Minister. The Delta variant was first identified in India in October. It was known as the India variant of concern before the World Health Organization introduced a new system of naming coronavirus variants, which uses the Greek alphabet. The first cases in Wales were linked to 2 clusters in Cardiff in early May. We then identified links to people in Newport and Swansea, and a third and larger cluster then emerged in Conway. Up until the end of May, we had relatively low numbers of the Delta variant, and most were linked to these clusters. But since then, we have unfortunately seen more and more unlinked cases across Wales. The latest information published by Public Health Wales today shows there are now 579 confirmed cases in Wales. It is moving quickly. We are seeing cases of the Delta variant in all parts of Wales. It is no longer confined to North and South East Wales, and there is evidence of spread in communities. The increase in cases of Delta is driving the increase in coronavirus rates, which we are now seeing across Wales. And about 4 out of 5 new cases of coronavirus are caused by the Delta variant at present. It is unfortunately a highly transmissible form of the virus. The latest evidence confirms this is more so than the Kent variant, which we now call Alpha. This is the form of the virus which caused the majority of cases in the winter peak. What we don't know yet in Wales is whether, as cases begin to rise again, this will cause an increase in hospital admissions and deaths. There have been 12 hospital admissions in Wales as a result of Delta to date, but this is likely to rise. We are at the beginning of a third peak driven by Delta, and we are probably 2 to 3 weeks behind what's happening in England and Scotland, where the Delta variant has been spreading for longer. There are more than 70,000 confirmed cases in England and just under 5,000 in Scotland. Based on the experience in Scotland, the risk of being admitted to hospital with Delta, if you're not vaccinated, appears to be at least doubled. Across the UK, we're starting to see an increase in the number of people who've been admitted to hospital, although at the moment this remains relatively low, which suggests vaccination is providing strong protection against infection and severe disease. I can tell you that around 2/3 of the people admitted to hospital in England were not vaccinated, compared to 11% who were fully vaccinated. But very sadly, Public Health England has confirmed 73 people have died in England after contracting the Delta variant. There is good emerging evidence to suggest that 2 doses of the vaccine is helping to reduce the risk of hospitalization as a result of the Delta variant, and this is why it is so important to have 2 doses of the vaccine. Ms. I'll hand back to you now.
Diolch yn fawr, Dr Jones. Now, on Friday, the First Minister said there'll be no further changes to the coronavirus regulations and alert levels for 4 weeks because of the spread of the Delta variant. The very latest figures show that Wales has the highest percentage of adults who have received both first and second doses compared to other parts of the United Kingdom. But we want to do more and we want to do it faster. We're going to use this 4-week period to speed up vaccinations to maximise the protection we can offer to everyone. So between now and mid-July, we'll be putting an extra 500,000 vaccines into the system, focusing on second doses and getting people fully protected. We'll be focused on offering a second dose to everyone in priority groups 1 to 9 over the next 4 weeks. That is everybody over the age of 50. All healthcare workers, social care workers and other vulnerable groups, including, of course, care home residents. And subject to supply, we'll be bringing forward appointments for the people over 40 so they don't have to wait longer than 8 weeks between their first and second doses. We're already making really good progress with second doses. Take-up is incredibly high at the moment, at more than 90% in everyone over 65. Now, we want this to continue, but we can only do this with your help. Mae angen I bawb I barhau I dderbyn y frachlin a chofio nad yw un dos yn ddigon. We need everyone to keep saying yes to the vaccine and to remember that 1 dose isn't enough. We all need 2 doses to complete the course and to have the best chance of reducing our risk of serious illness, especially as we face the spread of the Delta variant. Now, before I take questions, I want to say something about what we can all do to protect ourselves against coronavirus, whether we've been fully vaccinated or are about to have our first dose. Nawr yn fwy nag erioed, mae angen I ni gydweithio I reoli ledaeniad y feirws fel gallwn ni gyd barhau I fwynhau'r haf. Fe fydd y ffordd I ni'n ymddwyn yr haf yma yn cael effaith ar ledaeniad y feirws. Now more than ever, we need to work together to control the spread of this virus so we can all carry on enjoying our summer. The way we behave this summer will have an impact on this virus. We need to keep doing all those things which have helped keep us and our family in Wales safe. We need to keep our distance, to wash our hands and wear a face covering in indoor public places. It means keeping indoor spaces well ventilated, meeting people outdoors if we can, and working from home wherever possible. Dwi'n gwybod fod pawb yn ysu am weld diwedd ar y pandemig a'r feirws yma, ond mae'n dal yma. Angen I ni barhau weithio gyda'n gilydd I gadw pob un yn ddiogel. I know we all want to see the back of this pandemic and this virus, but it's still with us, and we need to keep on working together to keep us all safe. Diolch yn fawr I chi gyd. Dr Jones and I will now take questions from journalists, and the First Minister will be back here on Friday to provide you with another update about this fast-moving situation. Felly cwestiwn gyntaf, Owen Clark, BBC Wales.
Diolch yn fawr iawn a phrynawn da I chi'ch dau. A question for both of you, if possible, and could I ask the Minister to reply in Welsh as well, if that's at all possible? Diolch yn fawr. Dr Jones at the beginning mentioned that Wales was at the start of a 3rd peak. Was that a deliberate use of language compared to the talk there's been about a 3rd wave? And we know you constantly look at modelling from, for example, Swansea University, which has been very accurate in the past. What does that tell you about what the next month or so looks like, especially considering the speeding up of vaccines and what that might mean for the prospect of easing or resuming the easing of the restrictions in about a month's time? Diolch.
Diolch.
It is clear, looking at the acceleration in case rates in England and Scotland, that we are in the throes of a third peak. We are behind England at present in Wales, which is very good news. So we are in the pre-peak phase of a third wave. If you look back at the modelling from Swansea University in April, we are still more or less tracking at this very early stage the most likely scenario that was identified then. But the modelling going forward is more difficult because there are uncertainties about exactly how much more transmissible the Delta variant is than the previous variant. There are some uncertainties about the effectiveness of vaccination, although we are becoming more reassured about that. And of course, there are always uncertainties about public behaviour. But the worst of those options, the most transmissible, the least vaccine effectiveness, suggests we could have still a very sizable third peak, possibly even larger than January. And that is why we are emphasising today the need to continue our precautionary approach, that individuals need to continue to undertake all the measures which we know can protect them and their families and friends.
Diolch yn fawr, Owain, a jyst i ymateb yn glir, i ni yn ymwybodol ein bod ni nawr wedi dechrau i fynd mewn i'r trydydd ton, i ni ddim wedi cyrraedd y brig y trydydd ton eto. Mae'n edrych fel ein bod ni tua pythefnos tu ôl i'r hyn sy'n digwydd yn Lloegr. Mae'n glir hefyd bod yna lot i dal i ddysgu am y feirws yma a'r amrywiolyn Delta newydd yma. Felly ni'n dilyn gwybodaeth sydd gyda ni ac sydd yn dal i ddod oddi wrth y gwyddonwyr mwyn cael gwell dealltwriaeth o sut ddylwn ni ymateb. Ond mae'n glir fod y Delta yma yn lledaenu yn gyflymach nag unrhyw amrywiolyn sydd i ni wedi gweld o'r blaen, ac felly mae yna bosibilwydd y bydd y ton yn un weddol fawr. Wrth gwrs, beth i ni ddim yn gwybod yw i bara ddim a hynny wedyn yn mynd i trawsnewid mewn i faint o bobl sy'n dioddau ac yn gorfod mynd i ysbyty. Ni dal yn edrych ar y gwybodaeth yna.
Diolch yn fawr. To either or both of you again, and ac yn y Gymraeg hefyd. I know the Welsh Government, like elsewhere, is waiting for the advice of the JCVI on what vaccinations will look like in the autumn, whether that's boosters or potentially vaccinating children. Is the NHS in Wales sufficiently geared up to deal with all eventualities of that advice, in your view? And can you see any scenario at all where you'd need to mandate or make vaccines compulsory to anybody?
Shall I start on that? We're very clear that we're waiting for the JCVI to give their advice, both on the booster for the autumn and also for children. We'll be following that advice very closely when it comes out. But in terms of the readiness of the NHS, there are huge preparations that have been undertaken already. All of the health boards are already gearing up for potentially the rollout of an autumn vaccination programme. And when it comes to whether we'll go down the compulsory route, I think the massive success and the incredible take-up by the Welsh public of the vaccine offer means that we don't feel like we will need to go down the compulsory route. Obviously, there's been a lot of discussion about it in relation to care homes. The take-up in care homes has been quite phenomenal in Wales, and we're just chasing down now some of those areas which have not taken up that opportunity to try and understand why that is the case. Can I ask Dr. Jones if you'd like to add?
I mean, thank you, Minister. I don't have very much to add, but I do think we can all be really reassured by the success of the programme to date. You know, the hard work, the commitment, and the organisational competence that the programme has demonstrated, I think stands us in good stead. And we can assure you that the NHS is actually anticipating what JCVI might say and preparing for those eventualities. With regard to the autumn booster, you know, we're considering how that might be aligned to our flu vaccination programme. But as the Minister said, we're not in a position where there really is a clear need to think about mandating vaccination because the public have been incredibly supportive of this programme. So at present, there wouldn't appear to be any reason to think about it. And we wouldn't be all that keen. We would much rather people actually came forward because they wanted to and felt it was right.
Sy'n bateb yn Gymraeg yn gyflym, ni dal yn aros am y gwybodaeth o'r JCVI ynglyn â'r bwsta a hefyd os ddylen ni fod yn rhoi y frechlyn I blant. Wrth gwrs, mae paratoadau eisoes yn cael ei wneud gan ein gwasanaeth iechyd ni fel ein bod ni yn barod os maen nhw yn dod mas y canllawiau sydd yn awgrymu ddylen ni fod yn cael booster vaccine ein bod ni'n paratoi ar gyfer hynny eisoes a hefyd yn ystyried os allwn ni wneud hwnna ar yr un pryd a cael y brechlyn ar gyfer y flu vaccine. Felly mae yna bosibiliad y gallwn ni rhedeg y ddau beth ar yr un pryd. Adrian Masters.
Thank you, Minister. Could I just ask you, how, everything that you've said seems to suggest a very serious situation. How likely is not just further restrictions, but an actual lockdown of some form? And if not now, might that be possible in the autumn or winter? The Prime Minister has just said to expect a rough winter. Is that what you two are expecting as well?
Well, if I
Yes, please.
could start. I mean, there are a range of scenarios which are possible, as I've mentioned already. This is yet another critical phase in the pandemic, and it's a phase that's characterized by quite a lot of uncertainty. As I mentioned, you know, how is this Delta variant really behaving? We know it's a very aggressive form of the virus, highly transmissible, more likely to cause hospitalization, but equally there's emerging evidence that the vaccination remains protective, at least for 2 doses. So I think at the moment we just have to hold tight and gather further evidence about how things are going. The models that we are seeing exhibit some potentially not too severe outcomes now. It's something of a race between the virus and vaccination, and so that's why we're very keen to encourage everybody to come forward as soon as they can for their second doses. So there is a lot of uncertainty at the moment, and that's why a cautious approach is appropriate.
And just to add to that, Adrian, I think it's worth underlining the fact that actually what happens next really depends on how the Welsh public respond. We have some very clear guidelines in place in terms of how we would like the Welsh public to behave. If they did follow the suggestions when it comes to social distancing and wearing masks and washing hands regularly, then that would certainly help the situation. I think winter is a long way away, but at some point we are going to have to learn to live with this virus. But what we don't do in Welsh Government is to make any promises that we can't keep. That is not the style of this government. We want to manage expectations. We'll be following the data and we'll be following the science, and we'll be responding as and when that suggests to us that we should change direction.
Thank you both. I think this question is just for the Minister, but if you feel you need to add to this, Dr. Jones, please do. And it's about fan zones. The First Minister suggested that when Wales got to this stage that fan zones would be looked at. Can you confirm that the Welsh Government is looking at allowing fan zones? Could you say any more about how they would be set up, how they would be policed, and if they weren't managed, what would the risks be?
Well, I can tell you that the official government line is that we are absolutely delighted that we're through to the next round. And we do hope the whole of Wales will get behind the team in their efforts now to move forward in this competition. We were all ecstatic to see what happened on the weekend, but of course we have to manage this carefully. We have had some guidance from the police in Amsterdam, who have told us that they will not be letting Welsh fans into the country. And so that means that we would encourage you, of course, to stay here and to watch the matches carefully. If local authorities come forward and ask us for the setting up of fan zones, then of course we will, as a government, now consider that and publish guidelines for how that could be done in a safe way. It's a finely balanced argument, this, of course, because we are far more keen to see people watching the match outdoors, if possible, rather than indoors. And if we can do that in a controlled setting, then that would be much better than people going into other people's homes. Thomas Evans, Esblyrec.
Diolch yn fawr iawn, Gweinidog Iechyd, pnawn da i chi. Pryd ydych chi'n disgwyl y bydd gyda chi ddigon o dystiolaeth i weld a ydy'r brechlyn yn llwyddo i dorri'r cysylltiad rhwng y cynnydd yna yn yr achosion o Covid-19 a'r pwysau ar y gwasanaeth iechyd a marwolaethau o ganlyniad y Covid-19. Ac os gael gymryd Dr Jones hefyd ar hyn, when do you envisage you'll have enough evidence about the vaccine and whether it can cut the relationship between the number of cases of COVID-19 and the number of deaths from COVID-19 and the pressure on the NHS as well?
Can I ask you to start on that one, Dr. Jones?
Yes, I didn't understand the first part of your
Same
question.
question.
The same question. I mean, there is evidence now emerging that given the number of cases that we are seeing in England and Scotland, the rate of hospitalisation is lower than it was previously, which is excellent news. People who are unfortunately being admitted to hospital tend to be younger than they were previously. They tend to have not quite such severe disease, and in Scotland there's some evidence that there's a lower oxygen requirement. So all of this is really very encouraging. Public Health England have submitted a paper for publication that suggests that both the vaccines may have around a 90% chance after 2 doses of reducing hospitalisation. But as we're also seeing in England, there are still some people who are sadly dying. So the key issue is the extent of harm now. And that's what we will gradually, well, quite quickly, I think, learn over the next 2 or 3 weeks from experience in England and Scotland.
Just I ymateb I hwnna, Thomas, mae'r data hyd yn hyn yn argoeli'n dda iawn o ran y ffordd mae'r brechlyn yn gweithio, ac mae'n edrych yn debygol, yn sicr o un adroddiad sydd ddim eto wedi cael ei cyhoeddi gan Public Health England, bod yna bosibilrwydd bod 90% yn llai tebygol o fynd i'r ysbyty os ydych chi wedi cael y 2 frechlyn. Felly mae hynny'n argoeli'n dda, ond i ni yn aros am gwybodaeth swyddogol ar hynny cyn ein bod ni yn gwneud penderfyniad nag yn ystyried hwnna fel rhywbeth sydd yn ffeithiol gywir.
Diolch yn fawr iawn to both of you. Ac i'r Gweinidog yn ola, mae newyddion Esblyrec wedi clywed pryderon gan rai myfyrwyr am sut fydden nhw'n derbyn I hail ddos o'r brechlyn os fydden nhw'n symud adre dros gwyliau'r haf i'r ardaloedd byrddau iechyd gwahanol neu I rannau eraill o'r Deyrnas Unedig hefyd. Fyddech chi'n gallu rhoi eglurhad yr sefyllfa iddyn nhw ac a fydden nhw'n gallu cael I hail ddos o'r brechlyn mewn ardal wahanol I lle gafon nhw eu dos cyntaf?
I ni wedi rhoi canllawiau allan ar y mater yma. Just to repeat the question for those of you who don't speak God's language. The students, the question is whether students can get their second dose in a different part of the country if they return perhaps to England, or whether Welsh students are returning to Wales. Mae'r ail ddos yn rhywbeth I ni wedi rhoi canllawiau allan I wneud i'n glir beth sy'n digwydd yn yr achos yma. Os ych chi wedi enwi yn eich bwrdd iechyd lleol, mi fyddwn nhw yn cysylltu â chi. Ond mae yna bosibilrwydd nawr wrth gwrs y gellwch chi cerdded mewn I unrhyw ganolfan frechu, ac mi fyddan nhw wedyn yn edrych ar y manylion yna ac yn gallu helpu chi yn y sefyllfa yna. Felly mae yna bosibilrwydd a mae yna yn sicr yma yng Nghymru I ni fwy na parod I sicrhau eich bod chi'n cael yr ail ddos os ych chi'n fyfyriwr ac yn dod adre. Dan Bevan.
Thank you very much, Minister, and to yourself as well. Dr Jones, good afternoon to you both. these questions are more for yourself, Minister, but please feel free, Dr. Jones, to add if you wanted to. We've been told several times throughout this pandemic that the way out of it and the way out of lockdown restrictions are through vaccinations. In fact, you've said it once again today as well, that we're going to have to live with this virus at some point. But despite so many people now having antibodies, there are still freedoms being withheld from the public. And with us being at the beginning of a third peak, as Dr. Jones put it, it would appear that zero COVID is not a realistic target. So my question is, beyond the third peak, exactly where does that leave us? Do these lockdown restrictions go on for the inevitable foreseeable future, or where do you see sort of the end in sight, if you will?
Well, Dan, I think it's probably worth emphasising that actually compared to February, we have considerable freedoms now. And what's important is that we're able to continue with those freedoms, and we will only be able to continue with those freedoms if we, in the face of this new Delta variant, behave and we follow the rules that the Welsh Government has set out. We are very clear that we will have to learn to live with this virus, but we know our best chance of doing that in a safe way is if people are double vaccinated, which is why we are in this rush now to try and get as many people vaccinated as soon as possible, bringing forward those vaccinations for the second vaccinations to an 8-week period to make sure that people are as well protected as they can be. Once that's happened, then of course we will have to reassess the situation in the light of what's going on. But we are very aware that people want their freedom. We've given them quite a lot, I think, compared to February. But there are some sectors, of course, that are still living with restrictions. We're giving support to those sectors as far as we can as a government. But of course, we will keep on looking at the data. But we will always follow the advice of our scientists and the data. But of course, we will consider also the other harms that we need to consider. We know that mental health is an issue for many people within our communities now, and we're very keen to make sure that we can get back to a situation where we give as many freedoms as possible as soon as we can.
Thank you. And sorry, Dr. Jones, did you want to add to that?
Well, I know that ministers don't want to restrict people, and the only reason they do so is to try to protect them from harm. But we are supportive of pilots that are going on, I think, across the UK now to look to see what is possible when you've got both your vaccines under your belt. You know, is there something about self-isolation after international travel, self-isolation after you've been identified as a contact or someone? These are important pilots because they will show us what's possible. Now doesn't seem the time to relax too much, but on the other hand, it's a good time to gather information, and we welcome that.
Thank you. And going back to the subject of fan zones, we saw scenes of packed fans into Leicester Square on Friday, and that would probably underpin the idea that we do need more safe places for people to watch the football or face repeating those types of scenes here. Is that something that concerns you? And also, if you can't set up fan zones in the tight time frame, would you recommend people either watch the game at home or in a pub?
Well, thanks very much. Well, certainly we are very keen to make sure that people have the opportunity to watch the match in a safe environment. I can tell you, as Health Minister, I was watching those scenes with horror on the weekend, seeing quite so many people mix in some parts of England. We want to avoid that if we can, and that's why we will consider proposals that come forward from local authorities for fan zones that can be safely regulated. If you can watch the match outside, that's what our preference would be, rather than watching it inside with people, particularly if they're not in your bubble. Mark Smith.
Thank you very much indeed, both. This is a question to either of you really to answer. You've just mentioned that the 12 patients have been admitted to hospital with the Delta variant in Wales. Would you be able to give us any clarity on how many of them have had one jab, both jabs, or have had none at all? And would you also potentially be able to give some figures for the 579 positive cases identified across Wales, although I appreciate that might be more difficult and probably don't have that to hand. Thank you.
I don't know the data for all of the 579 cases. I know that of the 12, approximately half have not been vaccinated, and the other half have been vaccinated, either 1 or 2 doses, and broadly that correlates with the level of vaccination in the population. Can't really say any more because these are small numbers.
Okay, thank you very much indeed. And secondly, as you've already mentioned, a rise in COVID infection rates is then likely to lead to an increase in hospital admissions. Given that most lockdown restrictions have now been eased, which in turn led to a surge in non-COVID admissions to hospital, would it be fair to say it would only need perhaps a very slight increase in COVID hospital admissions for NHS bed capacity to be tipped over the edge, and then for non-urgent appointments and procedures to be universally cancelled again?
Should I have a go? I think it's a really important point, actually, you make about the pressure on hospitals. Our hospitals are, at the moment, having to look after relatively low numbers of people with COVID, which is excellent. Those numbers haven't significantly risen so far in Wales, but of course we're watching that very carefully. But what that means is they are able to start to get through a large amount of the work that we know needs to be done following the pandemic. And we know how important that clinical work is for people who are on waiting lists. So one reason why we have to be cautious, I think, is that if we start to see more COVID patients coming into hospitals, the impact that will have on everybody else, because there's harms in both areas. So I do think it's an area where we will have to keep a very close eye on things, but at present we're not seeing a significant increase in COVID in hospitals in Wales.
And I think it's probably worth emphasising that what we're looking at here is how we protect the NHS from being overwhelmed. It's always the kind of guiding force for us in determining where we draw the lines in relation to restrictions. Of course, as Health Minister, I'm very keen to address the backlog that has built over the past 18 months. There is a particular pressure at the moment on A&E, and so I would urge people to not call A&E unless it is life-threatening. There are alternatives that you can call, in particular the 111 service. So that would be something that would help to relieve some pressure on our hospitals. Twm Owen.
Hi. So what targeted interventions, and this is for Dr. Chris Jones, I think, so what targeted interventions are being proposed or are in place to actually prevent further infections? Obviously, we're aware of the public health advice that you've repeated, but is there any specific actions that you are taking to try and prevent the spread?
Well, I think we're talking to the public as we are about the importance of maintaining the protective behaviours. From a public health point of view, I think where there are still relatively low numbers of cases of the Delta variant, it is still reasonable for local incident management teams to try to contain those cases and limit their spread. In other areas where we think there's significant community transmission, we are dependent, as always, on our TTP processes, as well as public messaging around the importance of the protective behaviours. But once it starts spreading in the community, it is very difficult from where we stand to control that, and that is why it's so important that we see what the impact of that is in terms of the harms caused by coronavirus.
I think it's probably just worth adding that we have issued a significant amount of guidance for different sectors to make sure that they know how they can open safely and in a controlled environment. So all of that information is on Welsh Government websites.
Okay, and a question for you, the Minister. It's been reported that Didal Harding, in her pitch to be head of the NHS in England, has proposed challenging what's seen as a reliance on recruiting doctors trained abroad. We know the Welsh Government has targets to train and retain doctors, but are you concerned at any possible perception among potential recruits from abroad that they may be less welcome or have less opportunities in the UK?
Well, what I can tell you is that we are very dependent on the vast numbers of doctors that have been trained abroad and thankfully have come to help us out in Wales, in particular at this time of crisis. So we would be very concerned if we were to see any restrictions placed on our ability to attract doctors from abroad, and obviously we will be looking very closely at what the regulations, what the suggestions have been made by Dido Harding, and we will be very concerned if it looks like there will be restrictions placed. We should be celebrating these people who've helped us get through the pandemic rather than just looking like we're shutting the door on these people who have really stepped up at our time of need.
Thanks.
Rob Taylor.
Good afternoon. This is to whoever's best placed to answer, as you've both spoken in general terms about the picture across Wales, and the Minister has just mentioned some top-down guidance, but we have seen some specific issues in North Wales. Is it possible to have the latest local detail on areas of concern, what type of transmission is taking place, and if there's been any further specific local responses rolled out over the last few days?
I'm not in a position to answer in great detail about North Wales. We know there have been a number of clusters. Perhaps should say that in Wales we are very fortunate that actually we are getting genomic surveillance, we're getting genomic analysis of nearly all of our cases. So actually there's considerable intelligence out there about whether cases are linked or whether they are new cases on their own, where they may have come from. We know there have been some cases around people who've travelled from abroad. We know there have been some cases that have built around people who've travelled from outside Wales in England, perhaps. And clearly the northwest of England is an area where there are very high rates at present. There were a number of clusters. I think now there is community transmission. It's not so easy to separate them out. But I know that the incident management teams in North Wales are working really hard to contain and control this. It really is a very pressing challenge for everyone.
I was very fortunate to be able to visit parts of North Wales last weekend, and certainly we're aware that there are clusters in the Conway area, but there has been a really quick response from the Betsy Cadwaladr Health Board. We have seen surge vaccination centres being set up. I was fortunate enough to have been able to visit one of those based in Wrexham. And on top of that, they, I know, are organising pop-up vaccination centres in town centres, in city centres. So rather than waiting for people to come to centres, we are now making sure we're going to where people are. And so we do hope that people will take up those opportunities.
Thank you. Dr. Jones, you spoke earlier that a peak bigger than January is possible on some modelling. Is that cases, hospitalisations or deaths, or all three? And to be a bit more positive, what does modelling say about the vaccine impact? How likely is it that we'll see high cases but low hospitalisations? And to the Minister, you said you're putting 500,000 vaccines into the system, I think you said. Where's this extra supply come from, and why is it not already in there?
Well, as I mentioned too, there's tremendous uncertainty about the modelling at present because of all the different variables which are unknown. But the worst case scenario is of more cases than in the January peak. Probably not more hospital admissions in the January peak, but that does depend upon the extent to which the link between cases and hospitalisation has been weakened. So I don't think we're anticipating quite so many people being admitted to hospital as in January, but we are potentially at risk of lots of cases.
Rob, we've got 500,000 vaccinations ready. That supply was in the system already, so we were planning to do this. What we are doing now is to bring forward some of those second doses to 8 weeks rather than the 12 weeks, which was originally envisaged. So we're going as fast as we can. We know that it depends on supply in terms of how fast we can go beyond the next few weeks. But so far we do have enough AstraZeneca supply and enough Pfizer supply to take us through the next stage. Tom Magna.
Kerr's Wildlife. Thank you, Minister. I'd like to hear from both of you on each of my two questions. Your government has promised to deliver better integrated health and social care. Minister, how will you apply the lessons of COVID-19 in starting to join up these two very different sectors? And to Dr. Jones, at a practical professional level, if the Minister gets the politics right in the face of COVID-19, can health and social care work together in perfect harmony?
Well, thanks very much. I think this has highlighted the fact that we have a very brittle system of social care, not just here in Wales, but across the United Kingdom. So we do need an answer to this, and you'll be aware that the Welsh Labour Manifesto was very clear in our commitment, not only to make sure that we are valuing the incredible work that our care workers have made through making sure that they are paid the living wage, and of course they have also, we've also promised them a bonus for the work that they've already done. But also you'll be aware that we have published a white paper in relation to care, and we'll be working to make sure that the framework, an All Wales framework, is put in place to try and simplify the process and to make sure that we are working hand in hand, health boards, Welsh Government and local government, to try and smooth that process, because one is utterly dependent on the other. So we've got a lot of ambitions in this space, and we will be moving as fast as we can. The real problem, though, is that we really need the UK government to come up with their proposals, because it is going to be very difficult for us to move forward without their proposals. We will if we have to, but we would much rather know exactly what they're planning so that we can respond to that.
If I could respond by saying that during the pandemic, the interdependency of health and social care has never been more obvious. Just to give you an example, I chair, along with the Chief Nursing Officer for Wales, a nosocomial transmission group, which is giving guidance out about preventing outbreaks in hospitals and care homes. And we do that for health and social care. So we have mechanisms that have come into place during the pandemic which bind us together, which is great. We have to recognise that it's going to be something of a journey, because the arrangements and the organisational structures of healthcare are very different from those of social care. I think we have started on that journey during the pandemic.
Thank you very much for that. Minister, you didn't mention unpaid carers. You concentrated on paid care workers. Unpaid carers provide 96% of the care across Wales. So what assurances can you give our viewers that there will be real, noticeable change for the better? Happy for either of you to join in this.
Well, thanks very much, Tom. And I can't underline how much we appreciate the work that unpaid carers do year in, year out, but in particular during this pandemic, where I think they have been under significant pressure. And that's why we put forward some additional funding to give respite care to those people who have really been through a really difficult time. We recognise that they are doing a job not just for their families and loved ones, but also for the wider society in stepping in and helping out. And that's why we have made sure that that funding was additional and put in place.
I don't think I have anything to add.
Tom Prif, that's TV South Wales.
Hi, both my questions are for the Health Minister, but Dr Jones, feel free to add anything if you'd like. My first question is, Health Minister, will you be offering more support to the arts sector in Wales in wake of Music Venue Trust Chief Executive Mark Davies' comments, who, despite the relaxing of some hospitality restrictions, says the music venues in Wales still can't open as it isn't economically viable to hold gigs with current social distancing protocol?
Thanks very much, Tom. We recognise that this is a sector that has been hit extremely hard by the pandemic, and we recognise that there will be venues that find it difficult to open with the restrictions that we have put in place. The guidance is there, and there has, of course, been additional support for those venues. We recognise that some will be more able to open than others, but if you compare what we have put into place in terms of support to what they have had in England, I think you'll find that we have been far more generous, and especially if you look at what we've done for the freelance community in Wales, I think that has been really appreciated.
Thank you. And then lastly, in light of Nicola Sturgeon's ban on travel from Scotland to Manchester and Salford, will we be seeing any similar measures from the Welsh Government in an event of a third wave?
Thanks very much. I think we're in a very different situation, and I think we've got to understand how porous our border is with England. There are people who work in England, there are people who live in England, who work in Wales. So that has always been allowed under the rules for essential work. And therefore, it is really, really difficult for us to close the borders. And of course, we want to welcome people here to Wales. You know, our tourism, it's underway, the season has started, and we want to welcome people, but we would encourage them before they come to take a test and to behave according to the rules that we've set out here in Wales, rather than the rules that perhaps may be slightly different from those that have been set out in England. Diolch yn fawr iawn i chi gyd.